Good morning, guys. Welcome to your shift this morning. My name is Zainab and I'll be giving handover for your patient Angelina Carlino. Is everybody ready? Okay, so Angelina she's a 68-year-old female who was brought in by ambulance to the emergency department. Her date of birth is the 12th of September 1949 and her MRN is 0356760. She's under the care of Dr. Taylor. Now at about 7:30 this morning, she was brought in by ambulance after a syncopal episode query collapse at home. The collapse was witnessed by her husband. She'd stood up from the breakfast table, he reports. She did not lose consciousness, but immediately tried to stand back up and felt dizzy and lightheaded. She's known to have AF. The patient reports feeling lethargic over the past 7 to 10 days and has also noticed she's been feeling increasingly short of breath on exertion. She's been passing fresh blood in her rectum with clots for the previous 2 weeks, with some mixed into her stool. Now, approximately half to 1 cup full each time, 3 to 4 times per day, which is quite concerning. The last episode was about 2 hours ago. No melena, no vomiting, no hemoptysis. She's also complaining of mild, left lower quadrant abdominal pain. The patient has a background history of AF, so it's well controlled. She's on verapamil, previous cardioversion and ablation in 2004, which unfortunately failed, and she's therefore has chronic AF. She's anticoagulated, no previous strokes, thankfully. She's got hypertension, osteoarthritis. She battled breast cancer in 2001 and had a left mastectomy in 2001. No previous colonoscopy, so she's not had any checkups in regards to her gastrointestinal system. The medications she's on include 2 Panadol Osteos 3 times a day, warfarin 3 milligrams daily, ramipril daily, vermipril twice a day, excuse that. She's got allergies to sulfur. Now, she is an elderly lady who lives with her 80-year-old husband. She's of an Italian background. She's lived in Australia for over 47 years. Her English does remain limited. She's got 2 grown-up sons who live with their families nearby. They have been notified. She drinks occasional sambuca after dinner. She's not a heavy drinker. She doesn't smoke, and she's been a housewife all her life. Family history. She has 2 brothers that died from bowel cancer and a sister with breast cancer. She also has 4 other brothers with cardiac disease. On examination, she appeared quite pale with slightly increased work of breathing. Her obs were quite concerning. So heart rate is 135. She's got an irregular heartbeat. She's in AF. Blood pressure is 90/60. Respiratory rate is 30. SATs a 91% on room air. Temperature's 38.2, so she's slightly febrile. Her capillary refill is over 4 seconds. She's cold and clammy on her peripheries. She's got quite dry mucous membranes. Her GCS is 15, pupils are equal and reactive to light. Her JVP is not raised, her thyroid is not palpable. Her chest, she's got bibasal fine inspiration cramps, no peripheral edema. Her abdomen, when I did an abdominal assessment, seemed quite soft but slightly distended. She's got mild lower left quadrant discomfort, no peritonism. The medical team, they did a PR exam. There was some fresh blood on the finger. There was no melena, no masses were palpated. We did a chest x-ray. They showed no consolidation. She's got mild venous congestion and upper lobe diversion. On her abdominal x-ray, it showed normal bowel gas pattern, but there was some mild fecal loading. We did a 12-lead ECG, which showed she's in rapid AF. Her latest bloods show a drop in her hemoglobin to 62. Her white cell count was 16.8, her platelets were 284, and her INR was 5.8. Her electrolytes, her potassium was a 5, creatinine was 168, and her sodium was 136. So, yeah, she's got a fair bit going on. So we're just waiting back on the medical review to see what's going on. But look, the medical team are going in now. So basically just wait and see what they say, but she requires a full admission and assessment. Unfortunately, the shift has just been absolutely bonkers and we haven't got around to it. So can you guys please do that? And just see what the team have to say. Thank you.